Hi, welcome everybody. My name is Ryan Donnelly. I'm one of the admissions counselors in the admissions office here, along with my colleague Amanda Mills, with our colleagues from the health sciences areas that you're going to learn about tonight. Tonight is going to be about the healthcare fields. If any of you are interested in general admissions information, we do have sessions that we run multiple times during the week. And we'll have a link up for you to register for one of those. They're virtual. They go into more detail. We do give a brief one before our tours if you come in for a tour as well. So if you are interested in general information, please check that link as well. I'd like to introduce Teresa Blaskoff. She is the Admissions and Student Affairs Administrator over in the School of Health Professions. And I'm going to hand it off to her to introduce her staff, but also to introduce the program as well.
Thank you so much, Ryan and Amanda. This is so wonderful to have all of you join us. Again, my name is Teresa Blaskoff. I'm the Admissions and Student Affairs Administrator here in the School of Health Professions. And I just want to welcome everyone that joins me today from our program. So for our undergraduate programs in the School of Health Professions, we have Clinical Lab Sciences, and we have the chair, Jeannie Guglielmo. We have our faculty member, Audrey Grimaldi, and another faculty member, Lorianne Villalis, and student Katrina too. Lorianne, I'm sorry, I have to fix that your name. Respiratory care, we have Lisa Johnson, who's the chair. Our staff assistant, who's Victoria Ribolo. For our graduate programs, we have athletic training, who's our chair and faculty, Kathy Krashansky. And we have two wonderful students joining us, Brandon Ross and Amanda Goldstein. From medical molecular biology, we have our program director, Gloria Vivog. For our occupational therapy, we have our chair, Dale Cook, Dr. Dale Coffin, and student Joseph Cook. And for speech language pathology, we have our chair, Renee Fabus, and our staff member, Ryan Biglietta. And we also have on the call our assistant dean for academic and student affairs, Joni Schreiber. So I want to just take a minute and thanks so much for our faculty, staff, and students for joining us today. So I just want to just run through a really quick presentation, then I'm going to open it up to our programs and our students to give some insight on our wonderful programs. So the School of Health Professions mission is to provide the highest quality of education in an interdisciplinary learning environment that fosters research, scholar activity, critical thinking, evidence-based practice, leadership, professionalism, and importance of ethical behavior. So we take pride in our school's mission and really do a lot of interdisciplinary education with our programs. So joining us today, just to give you some oversight of the programs that are on the call today, athletic training. So athletic trainings are known as ATs. They specialize in management, prevention, and recovery of injury of athletes. Many times the athletic trainers are the first medical professionals on the scene after an injury, and athletic trainers collaborate with doctors to provide emergency and follow-up care and develop injury prevention and treatment for injured athletes. And in this presentation, you'll see our wonderful athletic trainers in action on the fields and a nice group shot of all of them. So we're very proud of our athletic trainers. The next program that will be joining us is Clinical Lab Sciences. Is a medical laboratory scientist known as the medical technologist or clinical laboratory scientist. These works to analyze and do a lot of different biological specimens. They are responsible for performing scientific testing and sample reporting results to those physicians. And again, these are our lovely students in action in our lab that is here in the School of Health Professions. So these students, as I'm showing you these photos, are all practicing in-house. So that's the lovely part of all our programs. And again, a lovely group shot of our students. Next is our medical molecular biology program. The molecular biologists are responsible. They look at plant, animal, and human genetics and variation of relationships between them. They work with DNA and RNA from human, plants, and animals, and are using their knowledge for chemistry, physics, and biology in their work. Again, these are our students doing hands-on experience, and another lovely shot of our students. Next group is our occupational therapy students. An occupational therapist works with patients who have conditions that are mentally, physically, developmentally, emotionally disabling. They work with these patients to develop and recover, maintain skills for living and working. So these students are working a lot with pediatrics, adults, so they do a lot within the hand clinics. Again, these are our students in action, working in the lab, doing activities with each other. And another lovely thing I like to add about our programs, we do a lot of interprofessional education. So a lot of our programs are working together in all the fields. Next is our respiratory care program. A respiratory therapist helps patients who have trouble breathing. Respiratory therapists work under the direction of the doctors to treat and range of the patients, from premature infants whose lungs are not fully developed to elderly people with a lung disease. They give patients oxygen, ventilators, administrate drugs to help the lungs. I would also like to add in, when we had COVID in 2020, our respiratory therapists were graduated early in April, and they were first to respond on the scene. So again, our students are working in these fields. They're going out, they're going right into work. And again, when I ask the programs to kind of give a little outline, they'll touch upon that as well. Speech language pathology. A speech language pathologist is a medical speech language pathologist who works in healthcare to diagnose and treat a wide range of speech, cognitive, and swelling disorders. They work with patients who are affected by neurological events such as brain damage, stroke, seizure, cancer. They also may work with chronic diseases who have experienced in trauma. So this, again, these are our students who are working and doing their clinicals and getting right in the field. So I want to just kind of show this because in healthcare, we can't do our job alone. So we all have to work together. So alone we can do so little. Together we can do so much, which is a quote from Helen Keller. And I just really, really take pride in what our students do and our faculty and staff. And now I would like to just kind of start with our program. I'm going to stop sharing my screen. Oh, and my last slide, I just want to show, these are our contact information. So everyone on the call, this is their email addresses, which we can give out to you as well. So if you have any follow-up questions, you can reach out to our faculty, staff, and students. So again, thank you so much. And now I would like to just start with our speech language pathology. Dr. Fabus, if you would like to just speak a little bit about speech language pathology.
Thank you, Teresa. So let's talk a little bit about who are speech language pathologists. Speech language pathologists work with a variety of different types of populations. We can work with infants, preschoolers, school-age children, adolescents, adults, and geriatric patients. We work to both assess, prevent, and treat a variety of communication disorders. Communication disorders is our big umbrella term, and under that, we help with speech disorders, including voice and fluency, language disorders, such as aphasia, cognitive disorders, such as dementia, social communication disorders, and swallowing disorders. So, for example, we may work with children in the NICU, all the way working towards working with the geriatric population who may have experienced dementia or a traumatic brain injury. We can work in a variety of different settings. We can work in hospitals, skilled nursing facilities, schools, universities, rehabilitation centers, private practices, private companies, agencies as well. So, and in terms of through US News and Report, they released some information that speech language pathology is within the top 10. I think it's number 3 for top healthcare job at this time. Salary ranges depending upon the type of facility that you're employed at. All speech language pathologists are required to be licensed and certified, which requires someone who's interested in going into speech language pathology to graduate from a master's degree program. So if you have any questions or you'd like some further information, please don't hesitate to reach out to myself or Ryan, and you can come visit us. We are located on the Stony Brook Southampton campus only, and we'd love to hear from you. Thank you.
Thank you so much, Dr. Fabus. I would like to now introduce Professor Guglielmo to speak about the Clinical Lab Sciences program.
Thank you so much. Welcome, everyone. Thank you for joining us today. So you saw a little bit about the clinical lab science position or profession from the slide, but basically what we're involved with doing is helping to diagnose diseases. So you have someone that's not feeling well, they go to a physician, and they will have different signs and symptoms. The physician may not have an idea what's wrong with the patient. And even if they're not really sure, they still have to take samples from someone. So you might often say, where do those samples go? I know a lot of people with COVID know about the swabbing and the testing that they had done, but they don't really know the background behind who actually does the testing. So the profession that my program represents is called clinical laboratory science. We also go by the name medical laboratory scientists. And basically, we are the individuals who are working in the lab to help diagnose, treat, and monitor patients. And there are so many different areas of the lab. So if you're the kind of student that really loves science, you love hands-on, you want to be part of the healthcare team, you're not necessarily sure if you want to be in the room with the patient, treating wounds, changing, giving medications, and things like that, but you know that you really have that hands-on, you want to be part of the team. This is a really great profession. There's so many different areas of the lab. I myself graduated from the program and worked in a forensic setting. So there's also applications of taking this knowledge and applying it to many different types of laboratory settings. And the starting salary, and a lot of this has to do with based off of COVID, is in the 90s. And that's with a bachelor's degree. And we are also, as was just mentioned previously with speech language pathology, we are a licensed and certified profession as well. So that's part of what we prepare you for. And we are also a 2+2 program, which means we have a series of prerequisites that are completed, typically within 2 to 3 years, depending on if a student is transferring. And then our program is a full 2-year undergraduate program, resulting in you graduating with a bachelor's in clinical laboratory sciences. Thank you.
Thank you so much, Professor Guglielmo. And again, I want to just thank Professor Valalis and Professor Grimaldi for being on the call as well. Now, Professor Johnson, can you speak a little bit about the respiratory care program?
Yes, thank you so much, Teresa. So welcome, everyone, and thank you so much for taking out your time this afternoon to find out more about health professions. You're definitely taking the first step in trying to make a decision of what you would like to do in your life. So for the respiratory care program, it is a profession that is an undergraduate program. It is a licensed profession. It's a program where students have to do the 2 years prerequisites prior to coming in. And sometimes it could be 3 years, it could be 4 years, depending on how long it will take for them to do it. And then once you are admitted into the program, it's a 2-year program from that point, and you will end up with a bachelor's degree. So what do you do as a respiratory therapist? If you are an individual who likes to work with people in the hospital setting, that's a place we can work. We can work as transfer respiratory therapists. You can also work in pulmonary rehabilitation. We work with all different types of patients. We work with patients who have different type of cardiopulmonary disorders, any type of difficulty with breathing. We are working with them under the guidance of a physician. As respiratory therapists, we are responsible for assessing the patient, monitoring the patient, managing mechanical ventilators, as well as giving different types of treatments and therapies, anything that can help a patient breathe just a little bit easier. We are part of that healthcare team at the bedside when you're working in the hospital setting. It takes a team to care for a patient, not just one person. It takes the doctor, to the nurse practitioner, to the speech pathologist, to the occupational therapist, physical therapist, physician assistant. It takes an entire team. And I know I left out some healthcare professions at the table, and people behind the scenes, the clinical laboratory specialists. It takes an entire team to care for that particular patient. And even if that patient's coming from the outside and they had an injury on the field, then you have the athletic training that's going to care for that patient. So we're part of that team that cares for the patient. If you are an individual who likes to be involved with the patient hands-on, then this is a profession for you. Sometimes people will say, well, I'm not too sure if I like blood. Is that going to be okay? I don't think I'm going to like sputum. Is that going to be okay? You know what? If you have this passion, then you're going to get past it and you're going to be okay. You really will, believe me, because I fainted the first time I saw blood, and here I am, a program director. So don't worry about it. You'll be okay. So it's a direction that you can go in. You're part of a team, you're licensed. And in terms of starting salary, COVID really took a hit and really kind of bumped up the starting salary. In the tri-state area, we're starting at anywhere between 80, and one hospital is paying $95,000 for a starting salary after you get your bachelor's degree. So that's here in the tri-state area. Maybe in other parts of the country, maybe a little bit lower, but it's definitely a profession that keeps you interested, intrigued, and there's a lot of different directions to go. I'm going to say one more thing. Also, we train our students to work in a sleep lab, right? How many times, people who have a difficulty with sleeping and they wake up and they kind of shake and they stop breathing? That's part of the training process as well for our program. So there's a lot of different directions you can go as a respiratory therapist once you get your degree. And if you have interest in and you want to find out more information about the profession, the emails are at the end. We have information sessions on a monthly basis, and we can definitely provide you more information. Thank you so much for joining us this afternoon.
Thank you so much, Professor Johnson. And again, I want to thank Victoria Ribola for also being on call. Thank you so much. Professor Kashansky, can you speak about athletics training?
Yes, again, I'd like to welcome everybody, and I'm so happy to be part of this presentation today. And I think, like my colleagues have said, you're taking the next step in really planning for your future and trying to learn about all the different healthcare professions and part of that healthcare team. So many people confuse what an athletic trainer is. They think that we're personal trainers and that we basically work in a gym, and that's kind of a fallacy. The name athletic trainer kind of promotes that, but what we really do is we tend to work with those people who are physically active, and we're basically utilizing our skills of prevention, management, assessment, and rehabilitation. And we overlap with a lot of the other professions as well. But our skill set is more aimed at the prevention, recognition, treatment, and then the rehabilitation of people who are physically injured, who happen to get injured on a field or even in a workplace, which I'll talk about in a minute. So, so if you have an interest in sports, which is kind of how I got into athletic training, is I always grew up enjoying athletics. And then I had a real good interest in the body and how the body works and medicine. And that's what formulated my interest in getting into athletic training and learning about the profession. So if you're looking for a challenge, an everyday challenge, athletic training may be a profession for you. We deal with things from those emergency situations, such as an asthmatic on the field, as Professor Johnson just mentioned, and then making that referral to medical care. Those of you who may have played high school sports or maybe playing sports in your college, you also may have access to an athletic trainer who's taking care of you, who's always on the sideline and in the athletic training facility, caring for your injuries and illnesses. You never know what you're going to encounter each day, and that's kind of the real passion that we have as athletic trainers. Our program is a master's program, so you do have to have a bachelor's degree, and that bachelor's degree can be in anything as long as you have the prerequisites. So you could have a biology degree, you could have a psychology degree, you could have a Bachelor of Science and Health Science degree. And as long as you take the prerequisites and have the GPA that we require, you can apply to the Masters of Athletic Training program. As far as employment goes, you normally see athletic trainers in a high school, college, or professional atmosphere. But there are these what are known as emerging settings. So now you're seeing athletic trainers working in occupational health with construction workers. You're seeing them in performing arts. So things like performers like the Lion King, Blue Man Group, all those who are doing physical activity on a daily basis, just like athletes are, they require the services of an athletic trainer behind the scenes. Also, you'll see with the military and with the public safety, they have athletic trainers that work behind the scenes, making sure that everyone is performing healthy and caring for their injuries and or illnesses. So we're part of this healthcare team. We are a licensed profession as well, and there's a board of certification exam that you need to take once you complete your master's degree. And we also work under the supervision of a physician. So there's multiple things that you're hearing, multiple themes that you're hearing throughout these presentations that kind of overlap. But your passion and your interest area is what should drive you. So again, we have information sessions, and we have a couple of students here on the call today that might be able to answer some of your questions about how they entered the field of athletic training. So thank you for your time today, and good luck to you.
Thank you so much, Professor Kashansky, and thank you, Amanda and Brandon, and we'll get to hear from them in a little bit. So thank you so much for being on the call. Dr. Verbove, can you speak about medical molecular biology?
Sure. Thank you, Teresa, and thank you, everybody, for being here. So the medical molecular biology program is a specialty of the clinical laboratory science. So most of our students have a bachelor's in clinical laboratory science, and then they want to specialize in molecular diagnostics. And molecular diagnostics can diagnose different types of diseases, including some genetic conditions, malignancies, and infectious diseases. Probably you are very familiar with PCR, that is stand for COVID-19. So you need to know how PCR work, how we do quantitative PCR or qPCR to determine whether a person has COVID-19. Not only that, but to, for example, patients with HIV or hepatitis B or C are not only diagnosed with those techniques, but also we follow the patient after the treatment to see if the amount of virus that they have circulating, that's called the viral load, goes down as the treatment is successful. Right? So we have two programs. One is the master's in medical molecular biology, and we also have a graduate program that is an advanced certificate, right? For the master's in medical molecular biology, you need to have a license as a clinical laboratory science. For the advanced certificate, you don't, but you need to have a bachelor's, and there are some prerequisites like the other professors told you about the graduate programs. Where can you work after that? Well, if you are a clinical laboratory scientist already, you can work in a clinical lab. Or if you're not, there's something that's called a restricted license. If you're interested about that, you can let me know. This is something that you can get in to work in molecular diagnostics in the clinical lab specifically, instead of just working in all the areas of clinical laboratory sciences, as you can do when you graduate from the clinical laboratory science. The medical molecular biology gives you a license to perform only those methods. If you want to work outside of a hospital, then you can do research, translational research, for example. You can work in the industry, developing new diagnostic tools. So those are many things that the medical molecular graduates they can do. We also have a specialty in flow cytometry, and flow cytometry is a method that doesn't detect DNA, but detects proteins or glycoproteins that are antigens in the white blood cells. And this is essential to diagnose lymphomas and leukemias. We also have a specialty in cytogenetics. Cytogenetics look at the chromosome abnormalities, either caused during a genetic inherited disease, or that's what happens also in cancer cells, right? Cancer cells become cancer cells because there are mutations and genetic rearrangements that make the cancer cell reproduce uncontrollably. So those are some of the things we can do, or you can do if you graduate from the medical molecular biology program. If you need more information, I'm sure Teresa is going to provide our contact information. I'll be happy to have more one-in-one, maybe Zoom information session. Thank you for your interest.
Thank you so much, Dr. Vigold. Dr. Coffin, would you speak about the occupational therapy program?
Sure. Thank you, Teresa. And good afternoon to everyone. Welcome, students and colleagues. Occupational therapy is one of the health professions that offers a very unique perspective to rehabilitation. Our focus is really on providing an essence for everyday occupation, for injury, for the client, and for the environment in which that happens. So for example, if you hurt your knee as a person, an OT will come and look to say, okay, what do you need to be able to do at home? Do you need to stand a lot to take care of your kids? Do you need modifications in your kitchen? Do you need assistance to help you dress yourself or to be able to drive again independently? So we look at the person holistically and to every area of life that their injury may impact. And when we talk about occupation, occupation is something that's throughout the lifespan. So as a child, your occupation is to play, it's to learn in a classroom, it's to participate with your peers. As you get older, it's to work in a facility or with a job. As you transition and you become elderly, there's certain other occupations that you may pick up. So we look at all of those different aspects of life and we value what you want to be able to do independently. And sometimes that may require modifications in the environment. It may require adaptive equipment. It may require adjustments in the classroom to help you learn better. It may require accommodations in a hospital if you're in a facility like that. So we look at every avenue of life that will impact you and help you to be able to lead independent lives. At Stony Brook, we offer a 3-year MS program, which includes all of your fieldwork rotations. So included with your classroom learning, you have to do 6 months of on-the-job training, and that's under the supervision and mentorship of an actual OT. And you do that in 2 different practice settings. So it could be with adults, it could be with kids, it could be in an outpatient clinic, et cetera, et cetera. One of the unique things about our program is that we offer 2 specialty tracks for our students, hand therapy and also sensory integration that you would use more specifically with children. We also offer monthly information sessions and you can sign up for that online through our website. We would welcome any student that was interested to come over and visit. We'd love to give you a tour if you would like to spend some time in the classroom and observe a class. That's something that we're opening up this year. And we're looking forward to answering any questions that you may have. We have a 2nd-year student on our call that is also, he's also served as a TA for our classes. So he can give you a unique perspective about the program. Thank you.
Thank you so much, Dr. Coffin, and thank you so much, Sarah Battaglia, who also works in the occupational therapy, for being on the call. And now this is the part where we're going to open it up to our students to give their perspective and their story. Since we just ended with occupational therapy, I'm going to lead with occupational therapy. So Joe, I would love for you to share your story, why you chose this profession, why did you choose Stony Brook, and any insight you can give to our prospective students of why, all the great things in healthcare.
Okay, hi everyone. My name is Joe, and as Dr. Coffin said, I'm a 2nd-year student with the occupational therapy program. I chose this profession mainly because it's versatility. You, like, as Dr. Coffin said, you get to work with all populations across a lifespan. And I found that to be amazing because I'm one that kind of gets bored. So if I don't work with adults, I can work with adults. If I work with pediatrics, I can work with pediatrics. What drew me to this program mainly was the implications of that it could have with working with the veteran population. I thought that was absolutely amazing, whether that be community integration or working with prosthetics. Because one thing about OT I really didn't know was you can work with mental health. I thought that was mostly social workers, psychologists, but we actually got our roots in the mental health field. I chose Stony Brook because I was an undergraduate student in the health science program. So I got to meet people that were in the program and they had nothing but good things to say about the faculty and with your peers, because you're going to know when you're in the classroom, you'll see all the people you're in class with on day one, they're going to follow you throughout your entire 3 years there. So you really build that like student family, and you all help each other with studying and homework and reminding each other about deadlines or complaining about deadlines. It's a really good opportunity. What else? My experience in the program, as Dr. Coffin said, it was a TA. The classes are rigorous. We do start out with heavy sciences. We start with anatomy and physiology, and then we go into kinesiology and neuro. But all these classes build on each other and you apply them to each single class. So you're going to take what you, oh, sorry, I muted myself. You're going to take what you learned in anatomy and apply it in kinesiology and then apply it in neurology. And then you're going to take all that information and then use it in the field, which I think is really awesome to see. Hey, I learned that in class the other day and this OT is doing it. Or I'm going to take that strategy I learned and see how it works. Overall, I absolutely love this program and I love the faculty. So if you have any questions about OT, feel free to email me and I'd love to answer them.
Thank you so much, Joe. And like Joe said, if you have any questions, please put them in the chat. We have our wonderful students and faculty and staff on this call, so they'll be happy to answer any questions. And one thing I just would like to add too that Joe mentioned, he did his undergrad in health science. Health science does fall under the School of Health Professions as well. And we do actually have a new track that we were kicking off in the spring of 2023, which is our exercise science track that would be part of our health science program. And some of those courses would be first aid and injury, strength and conditioning, intro to sports medicine, introduction to nutrition, and develop of health systems. So those are some of the courses that would fall into that track. There's a lot of other tracks that you could do within health science. There's also the clinical concentration tracks, which are medical dosimetry, anesthesia technology, radiation therapy, radiological technology. Say medical dosimetry, I think it did. So those, and we have other non-clinical tracks as well. So I just wanted to kind of piggyback kind of what Joe said. So if you're thinking about maybe doing an undergraduate in health science, that could help you into your graduate studies for athletic training, medical molecular, occupational therapy. So definitely think about that as well. Moving to our students in athletic training, Brandon, if you would love to share your story.
Yes, so hi everyone. Like Teresa said, my name is Brandon. I'm a second year student in the Massive Athletic Training program here at Stony Brook. So just some reasons why I decided to join why did I join athletic training and get into Stony Brook was that, well, first I've been an athlete all of my life and I've always appreciated what the coaches and the medical staff has always done around me to get me through just the athletics, everyday life, and all my injuries that I've had. I'm sure any other athletes in here can contest all the injuries they've had, and hopefully that the athletic trainers help them out with it. So I decided to pursue a career in the health professions. But first I wasn't exactly sure what I wanted to do, which I'm sure a lot of people also is in that same kind of boat. I first worked as a certified personal trainer alongside a whole bunch of strength and conditioning coaches and other specialists. Soon I worked as a physical therapy assistant for over 3 years. Then while finishing undergraduate, I began talking to some people and finding potential career paths, and athletic training seemed to really line up my interests in the athletic world as well as the medical world. So I reached out to a few schools, and the program director, Catherine Kashansky, was really helpful in getting me through the application process. She described to me a little bit what athletic training is and the hands-on nature of athletic training and how we become so close with our athletes and our patients to really give the best type of healthcare that we can. The thing that I love about our program the most is that from week one, when we get here, we really have the opportunity to use all we've learned in our undergrad, which I was an exercise science undergraduate from SUNY Cortland. And in my professional and as well as my professional experience from physical therapy and personal training to do proper like evaluations, and then soon getting into the clinical side where we're allowed to work with other athletic trainers and further our knowledge and in the actual field of athletic training as students.
Thank you so much, Brandon. Amanda?
Hi, everyone. My name is Amanda Goldstein. I am a first-year student in the master's program for athletic training. Why I decided to go into the profession goes along with what both Brandon and Kathy said. I've been an athlete since I could walk, so all these years being a triathlete, inevitable to have both big injuries and minor injuries. So I was very fortunate to have an athletic trainer be supportive in both the college setting and the high school setting for both the small things and the large things. So aside from just physically attending to our patients and our student athletes, we could also provide a safe space for athletes with mental concerns, which is like Joe was talking a little bit about, a field or something that's becoming more and more prominent that I feel like all healthcare providers should be aware of, knowing warning signs and just being there for our athletes. So that was something that definitely drew me in as an athletic trainer too, because I've had that support throughout my entire athletic career. Why I decided Stony Brook was I actually went to St. Joseph's College, which is in Patchogue, and they are actually a site for student athletic trainers to go to. So for my 4 years there, minus the COVID year, so 3, I was fortunate enough to have student athletic trainers always there with my team. So every year I talked to them about the program. What do you do? What got you into the field? And I'm fortunate to say that I'm still friends and hopefully one day colleagues with all of these who were once student athletic trainers and are now certified athletic trainers. They've really just said nothing but good things about the program and very supportive. And I was fortunate to know them when they were an undergraduate program. And then we also got the master's students. So having both of those perspectives is really helpful. And the networking for this program and everyone is it's really awesome and supportive. So having come from St. Joseph's College and everyone there was, raved about Stony Brook, and even an untraditional background. I have an undergraduate degree in recreational therapy. They were nothing but supportive and encouraging for me to apply to the program. So that's why I chose Stony Brook. And my experience has been great so far. It's definitely a lot right off the bat. We hit the ground running in May. I wasn't even graduated from St. Joe's before I started classes. But I have nothing but great things to say about all the professors and my cohort. They're really there for you in your highs and your lows. I mean, we succeed together, we fail together, we definitely go through it, but these are people you can rely on, hopefully lifelong friendships that we maintain. So my experience thus far has been really great with the program.
Thank you so much, Amanda. Again, if you have any questions for our students who would join the call for Brandon or Amanda for athletic training, please put those in the chat. They're happy to answer any of those questions. Katrina, could you talk about your experience in CLS?
Hi, my name is Katrina Tu, and I am a senior in the clinical laboratory science program. I remember when I was in high school, like you guys, looking for colleges, and Stony Brook was always at the top of my list because of their academic reputation and their diverse majors related to STEM. So I enrolled here as a biology major because I really love science. But afterwards, I didn't really know where to go with my degree. I love science, but I couldn't see myself working directly with patients because I couldn't see other people hurt. So later on, I learned about this program through a friend of mine who seemed really excited while telling me about it. I did more research and found that they had different areas of study you could go into, like microbiology, chemistry, blood bank, and forensics. And I ended up talking to the head of the program, Professor Guglielmo, and did a freshman declare, meaning that I could join the program after passing 2 years of prerequisites. Now I'm in my final year of the program and I'm having so much fun. We have lectures and learn about the 7 areas of the laboratory, and we also have practical hands-on labs that really reinforce the information we learn about. They're my favorite part of the program, and they really do prepare us for the real world when we go out for clinical rotations. So when we go out for clinical rotations, we learn how to work with many different instruments in the lab and get a good idea of what working in the field is like. It's also a great way to make connections. This program is great for giving students the opportunity to work in the lab even before they graduate. I have a few friends who work upstairs in the Stony Brook Hospital Laboratory as instructional support assistants who help out the lab. And I love this program so much. Everybody here is here to help you succeed. You can always rely on your peers, on your professors, and I would choose this program over and over again. Thank you.
Thank you so much, Katrina. And again, I wanted to thank again all our faculty and staff and students are on the call. And I know Dr. Pavas had another commitment. So I want to thank Ryan Viglietta. She's also can speak on for speech language pathology. And I think, Ryan, we're going to open it up for questions and answers, right?
Yep. Yeah. There's some questions that I had students ask me on the road that I wanted to save for this session, and then we do have questions in the Q&A. So for students who are interested in any questions, asking specific questions, if you can put in down by the Q&A at the bottom of your screen, you can ask us any questions you'd like, and we're happy to answer. And we will answer some of those that have come in. The question, I guess, that I have, that I get often is with the master's programs, the graduate programs, athletic training, medical and molecular biology, occupational therapy, and speech pathology. Is there a record? Athletic training already covered this. There's no specific major that they're looking for, which is most healthcare fields that you see. You can major in anything as long as you have certain prerequisites, like medical school, PA, PT. But for medical molecular biology, it looks like they're looking for something more in clinical lab sciences, but you do have the certificate. Is there anything that you would consider other than clinical lab?
Yes, that's a good question. Thank you. For the master's, you're correct, Ryan, you need to have a clinical laboratory science major. For the advanced let me explain, or you can have a biology major or a chemistry major. Make sure you have the prerequisites, which are, you can find it on the website, but they are microbiology, and the bios, the chem, statistics, and so you can have, as I said, you can have a clinical laboratory science, or you can have one of those majors and get a advanced, with the advanced certificate, you can get a restricted license, which you would get after 1 year training on the job.
Okay.
All right.
Great. So for occupational therapy, is there a preferred major, or does it work like PT and PA where it's certain prerequisites?
Yes, it could be any major. We've had art majors, music majors, as long as they complete those prerequisites, then it's fine. I think one of the things I didn't get to say about OT is that it's a very unique balance of art and science. So it's a great combination to be creative and have that science part. So as long as you have the prerequisites, it's fine.
Great. Speech pathology and anything?
Nothing, no specific bachelor's degree. A lot of the students come in with a linguistics or health science background, but we just have prerequisites as well, which you can find on our website: phonetics, anatomy, physiology, and speech, and speech science. They're all on our website. So it's 12 credits prerequisites that you'd have to have.
Great. What's nice about the programs so working with students at college fairs, you know, we have a lot of students who are interested in bio or psychology, and those classes can be big at Stony Brook. I think one of the nice things that everyone has pretty much said and covered here is that they get to know everybody, and that it's a much smaller community. Could you each go around? I'll start with athletic training and maybe give us an idea of how many students, whatever's easier for you to say, whether how many students you look to enroll each year, or how many students you have total in the program, whichever you prefer. I think either or will give students a good idea of the size. Kathy, yeah.
Sure. So our target is to enroll 20 students per year. So it's a very small class size. And as Amanda and Brandon both said, the small class size really kind of enables them to really work closely together throughout the program as their cohort. So that's our goal, is to reach 20 per year.
Medical molecular biology, the master's.
So the master's, also the target is 20. We usually have 15 students, so it's a small group.
Okay,
It's a good professor to student ratio.
great. And I'm going to hit the graduate, and then I'll go into the 2 undergraduate programs too. The occupational therapy.
So we have 2 cohorts, one at the Stony Brook main campus and one at Southampton. And our target enrollment is 30 students at each campus.
Okay, great. And speech pathology.
Our target enrollment is 30 students as well.
Okay. Are you out in Southampton also?
Yes, we are.
Okay.
Yes,
great.
we're only out in Southampton, not on main campus.
Only out in Southampton. Okay,
Mhm.
great.
Yeah.
And so for clinical lab sciences.
So we have an incoming class. We always have a class of 26 that we take, but we also have our returning seniors that are also usually a group of 26. So we have about 52 enrolled in the program,
Great.
but you'll have the 26 in any given class. And sometimes we even have lab sessions where we'll break the group in half. So you have an even smaller group, say 13 people to 1 instructor. So you really get that hands-on and that, personalized training. So it's a nice small environment. Yep.
And respiratory care.
Thank you. Our target is 28 students a year. Right now, we have a total of 41 students. Our numbers were a little bit low this month. We have 26 in our senior class and actually 15 in our junior class. But typically, we do have 26 students per year for our junior and senior class.
Great. So I'm going to switch to the questions from the group, from the students. So this is for speech pathology. What is the GPA cutoff for speech pathology major? For
The minimum is 3.0.
3.0. Okay,
Yeah.
great. And for speech pathology again, no, we've covered that. I'm sorry, we covered the undergraduate program. So this next question, is it possible, this is for Kathy Kashansky, is it possible to be both an athletic trainer and a sports medicine physician? I'm interested in both the treatment and prevention of sports medicine, and I'm wondering if this is an option.
Sure, absolutely, because it falls under the sports medicine umbrella. So to have a background in all the preventative measures, we go through, hydration, taping, stretching, flexibility, and all those, along with the medical aspect of taking care or managing of conditions. And the sports medical school is a lot different. So having this as a precursor to medical school is absolutely a good kind of a good progression to do.
Great.
And we have a couple of our alumni that have done that. So.
This is a question for one of the programs that is part of the health professions department. Maybe Joni, I don't know if you want to. I know the answer too, but I just didn't want to step on your toes. What paths may I follow if I spark interest in becoming an orthopedic PA or a physical therapist at Stony Brook? So someone who's balancing those things. They're in their undergrad, they're trying to prepare. What would you give?
Sure, happy to chime in. I've been quiet, I have a little bit of a cold. So we have both the physician assistant and physical therapy programs within our school. They're not represented today. We're not showcasing those particular programs, but those programs do host info sessions monthly, and students on this call can definitely check our website for those upcoming sessions to learn more about them individually. But generally, those both operate similar to OT and the other graduate programs on this call, that you can pursue any undergraduate major and take the necessary prerequisites. We see a lot of students that come out of health science and biology in those programs, But just as Dr. Kaufman was saying, you could be an art major, you could be history major, anything, and still pursue those PA and PT programs at Stony Brook. I don't know if Teresa, you might want to add anything related to that.
I think also too, I think it's important that to definitely, if you're interested in one of those, to really join those information sessions, because you can definitely get more information about each of those programs, or even maybe the programs, a lot of the programs mentioned today that they host information sessions too, because you really want to know what those prerequisites are or what courses you want to take. So I think attending those information sessions are really important.
Great. And the this is one for the clinical lab science. What is the minimum GPA requirement for a clinical lab?
So our minimum GPA requirement is a 2.5, and it also requires a C or higher in all of our prerequisites.
Is there usually, so the student did ask for nursing too. I know nursing's not part of this department. They were asking for, the GPA requirement. It does say 2.8 on the website, but I know to be competitive, students have to have, generally in the mid threes because people are applying. Do you find that students are, when they're applying, they have their grades, they have their prerequisites, but is there something that is you're looking for in terms of each applicant, like extracurricular, volunteer work, research for clinical lab sciences?
That's a great question. Thank you. So although the minimum GPA is a 2.5, I have to say most students that apply have a 3 or higher. It's more common to be between a 3 and a 3.5 or even 4. So how do you set yourself apart? Well, one way is learning as much as you can about the profession, so that when you are invited to come to the interview, you know a little bit about the profession. One great way that you can learn more is we have an introduction course. It's called HAD 210. And this HAD 210 is Introduction to Clinical Laboratory Sciences. We do require all of our freshman declares to take it, but it's not a bad idea for someone who's a junior or a senior, and maybe you're a bio major and you're not sure if this is a great fit for you. You can go ahead and take this course as well. It's offered every fall and spring semester, always on Wednesdays from 12 to 1. And this would be a great way for you to learn more about the profession. We do not require shadowing hours or volunteer hours, but I have to say, someone that does have some experience, they just make for a richer interviewee, because when you're asking them questions about, which area of the lab do you see yourself working in, and they can say, oh, I spent some time in chemistry and this is what I observed and I really loved it. Or likewise, they may say, I found that wasn't a good fit for me because I think I'm really gravitating towards microbiology. So those would be the items that I would tell students to, look into getting involved in to help them.
I apologize. For respiratory care, would you say that you're looking for things similar, students who kind of research that kind of know what the program does?
Yes, my response will be similar to Jeannie, so it's going to make some things slightly different. For what's most important is to do the research. That's one. In terms of doing shadowing, we would love for you to do that opportunity, but a lot of hospitals don't allow students to come in anymore if they're interested in the profession. If you're able to do that, that's great. Sometimes when we have individuals who worked as a CNA in the hospital, or they had some type of employment in the hospital, they're kind of familiar with what a respiratory therapist does. Just like Jeannie, we also have a course called Introduction to Respiratory Care. It's offered on Thursdays from 1 to 2, and it is a great way to find out more about the profession. It's an opportunity for students at Stony Brook, and sometimes we have taken students from the outside as non-matriculating students just to find out more about the profession, and it allows them to find out a couple of things. Is respiratory therapy something they want to do or they don't want to do? And it's really very good. They talk to all the different faculty in the program. They also have the opportunity to talk to alumni as well. And we show them about different therapies and procedures. So in terms of what else could they do, if they can't take the course, try to talk to individuals who are already in the profession to find out about respiratory therapy. Come to our information sessions and also talk with us. we can put you in contact with students as well who are in the program or alumni. So if a student takes that initiative, they're really trying to find out more about the profession to determine if that's the direction they actually want to go. So that's what they can do. So therefore, they would make them a stronger candidate when they come in for an interview.
Ryan, I just want to add, we also have the introduction to occupational therapy. It's HAO 313. It meets Mondays 4:30 to 6:30. That's in the spring semester. So we do have that course for occupational therapy as well, just like CLS and respiratory care. So I just want to add that.
Yeah, it's offered in the fall and spring.
Yep.
Great. Yeah, and just to clarify for students, yeah, current students that are West Campus students that are here will know about this or may be familiar with this. For freshman students and transfer students, clinical lab sciences and respiratory care are the two undergrad programs that we talked about today. And they're junior year. They start junior year, and senior year, you're immersed into that major, where the first 2 years you're doing your prerequisites, you're preparing for that. So like what Teresa said, there'll be opportunities if you are an undecided student or thinking in terms of healthcare, that you might be able to take some classes that could introduce yourself to those programs. And then of course, with the graduate programs here, we have all the preparation and the prep courses and the prerequisite courses for those programs, and the advisement for that if students need that in terms of preparing for going on to a graduate program. Before we end the session, is there anything anybody'd like to mention? Teresa, is there anything you'd like to mention in terms of, I guess if students have more questions, they should contact how would you rather them contact you guys? If I know some of you offer info sessions, some of you to, may be able to meet with students.
If once we have all the contact of who attended the session, Ryan, I can email the PowerPoint presentation to all the students on the call, and that will give all our faculty and staff who attended today all their email addresses. So I would love to do that, so that if they want to reach out, especially to our students, I thank them so much for participating in this call. And the one thing two things I would want to add before we close. One, I think it's really, really important if you're interested in any of our programs, undergraduate or graduate, that maybe come, reach out to our program directors, reach out to our faculty, and come see us. I think that's really, really important that you come visit us in the Health Sciences Center, see what we do. We could work out a tour for you. I think it's really important for you to understand what each of our professions do. And lastly, I just want to open it up to our faculty and staff that are on the call. Audrey, Lorianne, if anything you would want to add to these lovely students.
I'd just like to add, can you move that, Jean? I just wanted to add, sorry. Yeah, hold on, let me switch. Hi, sorry about that. Is that a little bit better? A little bit of an echo. I just wanted to add the CLS program is a great program, like we've mentioned. It's a small group, so the faculty really get to interact with the students. We really get to, work with them and, kind of guide them and teach them. And so it's a wonderful experience, and, great to have the options to go into the different areas, micro, hematology, immunology.
Thank you so much.
Sure.
I think I don't know if anyone else wants to add anything. I think we're all kind of wrapping up. Again, I want to just kind of thank so much for the faculty, staff, and students for joining this call. And I really, really, really would love, again, just want to stress, come visit us, really get to see what we're doing over here. We do so much great things. Our professions are doing so much with the students in the clinics, in the hospital. So really, once I get all this information, I'll send you this PowerPoint and connect with our faculty and staff and students. Thank you so much.
Yes, and I want to thank everybody for being here too today, our faculty, students, and staff. Thank you very much for letting our students know more about your programs. We get the questions all the time on the road. There's only so much information we can provide, but we really appreciate the time you've taken out tonight. And thank you for the students who have who've tuned in tonight too. Thank you very much. Take care, everyone.
Thank you.
Thank you.